Welcome to Podcast Wednesday. This is Lori Davis Hill, Director of Six Nations Health Services and Incident Command for the Pandemic Response during the COVID-19 pandemic. Scano, Sago, welcome once again to our midweek COVID-19 response update. I know that these are challenging times given our current circumstances, and I know that times like we are experiencing now can lend themselves to weighing on our minds. So let's see if we can give our minds a little bit of support as we welcome a visitor to our wellness section. Joining us today, we go beyond health services and welcome Larry Longboat from the Social Services Department. Good morning, Larry. What would you like to share with us today?
Hi, Laurie. Good morning. I'd like to share that Six Nations Child and Family Services is pleased to announce the addition of texting to the Six Nations Mobile Crisis Service. Texting and live chat support will be available on Monday, May 4th, 2020, so we started it last week. The new services feature safe and encrypted technology to keep conversations confidential and secure. Users will be connected with trained crisis response workers who will provide support and referrals. Our partners help us to provide coverage of the line. Our partners include Six Nations Health Services, Mental Health and Addictions, as well as Social Services, Youth Life Promotion, Children's Mental Health and Addictions, and the Six Nations Crisis Coordinator. During the pandemic, Six Nations Mobile Crisis Service has been offering phone crisis support and are working with Six Nations Mental Health and Addiction to provide mobile support. We hope the new avenues to communicate will provide the support needed while we are limiting physical interaction during this time of distancing. If you are looking for crisis support, please contact us at 226-777-9480. For live chat support, please access us through the live chat button on the Six Nations COVID-19 website at www.sixnationscovid19.ca. Text and live chat will be available on weekdays between 8:30 and 4. If you need support outside of those hours, please reach out to us by phone at 866-445-2204 or 519-445-2204. Anyone in immediate danger is asked to contact 911. Thank you. That's what I would like to share today.
That's great. That's a much needed service for the community. So I'm really happy to hear that. So thanks Larry for stopping in and providing us with that information. I know we're all starting to have COVID-19 fatigue, but it's time. Now is the time to let us draw upon our inner strength as Haudenosaunee and remember we might be Six Nations, but we are one family. Let's see what the numbers have in store for us today locally and for our neighboring communities. Right now on Six Nations, we remain at 11 positive cases. 10 of those cases have resolved with one death. Currently, we have no active cases. To date, we have completed 483 tests and have received 415 negative results. We have 51 people in self-isolation as directed by Oswego Public Health. Please continue to identify symptoms and get testing to help us monitor the impact of this virus on Six Nations. The statistics in surrounding communities are as follows. New Credit has one positive case reported. Haldimand Norfolk Public Health Unit, 201 positive cases, 75 resolved, and 30 deaths. Grant Public Health Unit reporting 102 positive cases, 89 resolved cases, and 3 deaths. Hamilton Public Health Unit reporting 490 cases, 360 are resolved, and 24 deaths. And Toronto Public Health reporting 7,775 positive cases, 5,449 are resolved, and 622 deaths. We all know it's coming. We all know the weather's getting nice, and we know what I'm talking about is May long weekend. Some call it Victoria Day, and some call it Bread and Cheese Weekend. We request that people continue to exercise physical distancing, wear cloth masks when out in public, and to continue to frequently wash your hands for 20 seconds throughout this weekend. The Chief Medical Officer of Health for Haldimand Norfolk has decreed that any cottage owners should stay away from migrating toward their cottages to avoid bringing the COVID-19 virus from their current location to cottage country, in a location that does not have the medical resources available if an outbreak should happen. Let's avoid a COVID calamity and let's be COVID clear. However, if you are experiencing any one of the COVID-19 symptoms or any other new or unusual symptom, it is important that you call the Six Nations COVID-19 Assessment Center at 226-446-9909 or toll free at 1-855-977-7737. The COVID-19 hotline is open 7 days a week to take your calls. As we close in on a long weekend, a few more announcements. Call the Project Protect Our People hotline at 519-717-6639 for any information regarding accessing checkpoint passes or general access to the community questions. If you or your children are in need of routine immunizations, you can call the Oswego Public Health Office at 519-445-2672. All immunizations are currently being booked by appointment. You'll go through a screening process when booking the appointment and then again when you arrive. Public Works has put out a call for homemade masks, and any and all donations will be greatly appreciated. You can call 519-445-4242 for more information. And if, like Larry said, you would like to connect with the Six Nations Mobile Crisis Service, you can do so by phone, 866-445-2204 or 519-445-2204, available 24/7. You can contact them by text Monday to Friday, 8:30 to 4 at 226-777-9480, or by live chat Monday to Friday, 8:30 to 4, accessing from the Six Nations COVID-19.ca website. You can also find community information and information about COVID-19 on that website. So keep the good mind. We will get through this COVID-19 virus pandemic, and more importantly, think about the frontline workers. Please stay home for them. Please stay home for all of us. Stay well and stay safe. Nyawa.